In 1935, a discovery sent shockwaves through the scientific community. Neurophysiologist John Farquhar Fulton had performed an experiment that would spark one of the most controversial medical practices in history. After removing the frontal lobes of two chimpanzees, he observed something astonishing. The animals no longer displayed frustration or anxiety. To his research associate, it was as if they had joined a happiness cult. The chimps had lost some cognitive abilities, but they appeared calm, detached from the emotions that once troubled them. For Portuguese neurologist Egas Moniz, this was not a loss, it was a revelation. What if the same procedure could be applied to humans? What if the burden of mental illness could be lifted with a simple surgical intervention? In Moniz's eyes, this was not just a possibility, it was a solution. And it was this conviction that led him to pioneer one of the most devastating and unethical treatments of the 20th century, the lobotomy. At the time, the field of mental health was still in its infancy. The understanding of mental illness was murky, and conditions like depression, obsessive-compulsive disorder, and schizophrenia were often lumped together with little distinction. Moniz had a theory, one that would dictate the course of his life's work. He believed that these disorders arose from negative thoughts becoming physically stuck in the neural pathways that linked the thalamus to the frontal lobes, the parts of the brain responsible for regulating emotions and sensory experiences. And if these pathways could be severed, then perhaps so too could the symptoms. His solution was the prefrontal lobotomy. The procedure was as brutal as it was simplistic. A surgeon would drill into the skull and slice through the white matter that connected the prefrontal cortex to the rest of the brain. The idea was radical, and many in the medical community were horrified. Even as Moniz pushed forward with his experiments, critics condemned the notion of carving into the brain as a cure for psychiatric disorders. But Moniz was relentless. He performed the procedure on 38 individuals suffering from conditions such as anxiety, schizophrenia, and severe depression. The results? A hastily written report claimed that 2/3 of these patients showed improvements. Moniz declared success. His patients, once plagued by distressing thoughts and uncontrollable emotions, now exhibited a calm demeanor. To many, this was proof that the lobotomy worked. At the time, tranquil behavior was often equated with recovery. If a patient was docile, agreeable, and no longer troubled by hallucinations, then surely they had been cured. The world took notice. Newspapers hailed Moniz as a revolutionary. The medical community, desperate for a solution to the growing number of institutionalized patients, embraced the procedure. And in 1949, Moniz received the ultimate validation, the Nobel Prize in Physiology or Medicine. His work caught the attention of American neurologist Walter Freeman and neurosurgeon James Watts, who would become the loudest advocates for the lobotomy in the United States. At the time, the country was struggling with the burden of psychiatric institutions overflowing with patients. Nearly 500,000 people were institutionalized, many of them considered undesirable by the rigid standards of the era. If the lobotomy could allow them to live what was deemed a normal life, then perhaps it was the answer. But from the start, there were problems. For one, the definition of a normal life was deeply flawed. Countless individuals had been institutionalized not because they were truly mentally ill, but because they didn't fit into societal expectations. Women deemed too emotional, people who expressed same-sex attraction, and those with disabilities found themselves subjected to the procedure, their personalities irreversibly altered. And even in cases where the lobotomy did seem to reduce extreme distress, the side effects were staggering: cognitive impairment, personality changes, and a loss of emotional depth that left patients in a state of near catatonia. One of the most infamous cases was Rosemary Kennedy, sister to future U.S. President John F. Kennedy. In 1941, when she was just 23 years old, she underwent a prefrontal lobotomy. The result was catastrophic. A once vibrant and expressive young woman was left unable to speak properly or walk on her own. What was supposed to be a medical miracle had instead reduced her to a shadow of herself, a cautionary tale of the true cost of tampering with the mind. Yet the lobotomy craze did not stop. The procedure was expensive, requiring trained neurosurgeons and specialized tools, making it inaccessible to many. That is, until Walter Freeman introduced something even more extreme, the transorbital lobotomy. Freeman's version of the procedure was designed to be quicker, easier, and cheaper. A patient would be rendered unconscious with electroshock therapy. Then, a long, thin instrument, eerily similar to an ice pick, would be inserted through the eye socket and hammered into the brain. A few swift movements severed the crucial neural fibers. The entire process could be completed in under 10 minutes, and unlike the traditional lobotomy, it didn't require a surgical team. Freeman believed any physician could perform it, and so he went on a campaign to prove its efficiency. In a shocking display, he performed 228 lobotomies in just 12 days at a West Virginia mental hospital. He would demonstrate his technique to crowds, sometimes using both hands to operate on 2 patients at once. For him, this wasn't just medicine, it was a spectacle. But even those who had initially supported lobotomies began to recoil. Freeman's own partner, James Watts, distanced himself from the reckless crusade. The idea of such a delicate and dangerous surgery being performed without precision, without proper training, without real consideration for the long-term effects, was too much to bear. The tide finally began to turn in the 1950s when a new class of drugs, antipsychotics and tranquilizers, emerged. Unlike the lobotomy, these medications offered a way to manage psychiatric symptoms without permanent, irreversible damage. Slowly, the medical world abandoned the procedure, realizing that the true cost of this so-called cure was far too high. By the mid-1960s, the lobotomy had all but vanished from legitimate medical practice, but it had already cemented itself in public consciousness. No longer a symbol of hope, it became a horror story, a grotesque metaphor for the brutal silencing of those who dared to be different. Science fiction and horror films depicted the lobotomy as the ultimate violation, an attack on the very essence of what makes a person who they are. Today, the lobotomy is viewed as one of the darkest chapters in medical history. It stands as a chilling reminder of what happens when science is driven by ambition rather than ethics, when the rush to find a cure overshadows the responsibility to do no harm. It is a lesson in humility, a lesson in caution, a lesson that, in the pursuit of progress, we must never forget the humanity of those we seek to heal. If you want to get basic overview of anything, provide your thoughts and intentions in comment section. We will provide and serve you, and subscribe our channel to get more information in less time.